have been able to we have been able to reach out to quite a few people who would otherwise not have actually made it to the meetings, in-person meetings, because of their physical disability or their dependency on others. So I think that is something that's a good thing that has happened with all these online programs. And of course, Darshpreet is going to tell us all about it, the good and the bad, the good, the bad, and the ugly about online online programs. But yes, I think this is something that we should, in a way, the pandemic has done us a big favor. Everybody has learned, how to handle technology a lot better, and how and technology itself has been simplified for people to because of all these various programs, platforms that have come up. I think, Dashpreet, I have said that I would wait till yeah, and I think it's time. So I think I'll start the program, right? Okay. So namaskar, everyone. A very warm welcome from all in the Mumbai chapter of Multiple Sclerosis Society of India, on this occasion of our second webinar commemorating the Indian Multiple Sclerosis Day 2022. We have with us the universally liked Darshpreet Kaur, a very senior physiotherapist in Neuro Rehabilitation from Patna. She has been associated with many eminent institutions, both in India and abroad, and has many publications to her name. Darshpreet Kaur is perhaps one of the best things that could have happened to Multiple Sclerosis Society of India. Not only was she the first physiotherapist from India to showcase MS in the factoriums in Japan many years ago, but she has gone on to devise and implement so many fitness regimes for multiple sclerosis persons, and which she has now taken online too. Today we are going to listen to her telling us about the impact she thinks that the fitness regime has on our MSPs. Darshpreet, मैं आपसे विनती करती हूँ कि आप हमें एक सफर, एक जर्नी पे लेके जाइए, जिसमें आप हैं, हम हैं, और हमारे MSP के लिए, हमारे मल्टीपल स्क्लेरोसिस पर्सन्स के लिए एक फिटनेस रेजिम भी है. So Darshpreet, please go ahead. The electronic platform is all yours. Take this meeting forward. Thank you.
Thank you so much, Rekha ma'am, for your kind words. And I feel this is one of my most beloved platform, I would say. I don't know, whenever I get a call from the Mumbai chapter, whatever be my schedule or everything takes a backstage. My family takes a backstage. All I see is MS. So I would say all you people working for MS Society, you are magnetic. You force people to leave rest of the things in the world and just focus on this line. And probably this has been a very important guiding principle. And as I always say, Sheila ma'am is the one who changes life for better, for sure, for better. And she gives direction and it's just fantastic that this family, this has really grown in numbers, this has grown largely in numbers, and we are so connected now that it feels like if I don't interact with MS patients, it feels like I'm not interacting with my family. I'm not giving a family time. So, with that, as ma'am said, we started with our online rehabilitation session last year, and it was the first time ever, I would say, and not just in India but in Asia also, and maybe worldwide, because this was quite different. We had all thought about it, how to be available to our patients, not physically but yes within their homes, and we tried our best so that they do not feel left out, they do not miss out on their sessions. The experience, definitely, it was sweet, it was sour, not ugly at all, not ugly at all, because experience is experience, and that actually paves way for us as a rehabilitation expert and also a part of MS society. Definitely it gives us an insight that how we need to change our ways of giving what is required by our MSPs, and at the same time without them realizing that we are becoming quite strict with them. uh, you know we try to tell them what we need out of them without being very strict teacher, but definitely being very stern कि ये आपको करना ही है. So this year again I have a surprise box. I have something interesting coming for you all, but उससे पहले जो आप सबने मुझे एक साल तंग किया है, प्यार दिया है, वो definitely वो हमारी जो प्यारी सी मीठी सी एक स्टोरी बनी है, I would share with you all. So Rekha ma'am, if you may permit, I'll start sharing my slides.
Please do that.
Yeah. Yes, so my slides are visible?
Yes, they are.
Okay. All right. So the topic is real versus real physical rehabilitation in MS. So today I'll make sure like I bring before you the exact things what we have been doing and what we expected out of our MSPs and what exactly finally we achieved. Okay. So okay, first of all, for all those people who still don't know what is physical therapy, it is a form of non invasive care that helps ease pain and improve physical function. So, simple शब्दों में हम वो टीके वाले डॉक्टर नहीं हैं. We are health care professionals जो कि non invasive तरीके से, हाँ सुई हमारे में भी लगती है बट वो वाली नहीं जिससे अधिकतर लोग डरते हैं. But yes, that's a different therapy altogether. So, it's a non invasive care. And it is more than much more older than 137 years, right? So ये कुछ भी ऐसा नहीं है जो 10-20 साल पहले आया है, एंड बहुत बहुत पहले हिपोक्रेट्स के टाइम से ही कहते हैं इसका ओरिजिन हुआ था, बट दैट टाइम इट वाज मोर इनटू जिमनास्ट एंड ऑल दोज थिंग्स. बट अब जाके इसका जो एक फॉर्मल शेप एज अ फिजिकल थेरेपिस्ट बनी थी, दैट वाज इन, yeah, that was in 1894, then 1913 and then 1914. different countries में associations बनती रही हैं. luckily India में भी हमारी Indian Association of Physiotherapy है, which is also very old organization. Now, if we talk about physiotherapy programs, they do not overexert or endanger a person. अगर बहुत तरीके से फिजियोथेरेपी करी जाए तो आपके जीवन को कोई भी खतरा नहीं है. In fact, we focus on basically improving your walking pattern, avoid making your symptoms worse, making you learn to adapt to physical changes, regaining function and abilities after a relapse, developing strength and endurance over time, improving and easing any specific symptoms that you might suffer from, increasing range of motion and flexibility, and correctly using movement devices such as cane, mobility aids, scooter and others. So ये एक this is kind of a summary, एक समावेश है कि एक फिजियोथेरेपिस्ट क्या क्या कर सकता है. ज़रूरी नहीं है सारी चीज़ें एक पेशेंट को यूज़ हो, बट डेफिनेटली जो जो यूज़ होता है उस हिसाब से इसको कस्टमाइज़ किया जाता है और पेशेंट्स को दिया जाता है. Okay, and exercise therapy has been well advocated by lots and lots of MS societies internationally. Now, how it can help during different stages. I'm sure आप में से जिनको भी MS है या उनके केयर गिवर्स हैं या हेल्थ केयर प्रोवाइडर्स हैं, अभी तक हम लोग MS के डिफरेंट स्टेजेस को जान चुके हैं. सो अगर हम फिजिकल रिहैबिलिटेशन की बात करते हैं तो इसमें बहुत ज़रूरी होता है हम पेशेंट के डिसेबिलिटी लेवल को समझें और उस हिसाब से उनको इलाज कराएं. So it is important at all the stages, and the stage of the disease will determine the specific goal. आप जिस स्टेज में आपको MS हो रखा है उसी हिसाब से हम लोग बताएंगे आपको क्या क्या रिहैबिलिटेशन सेशन देना होगा. आफ्टर डायग्नोसिस इनिशियली फिजिकल थेरेपी में हम लोग क्या करते हैं, एजुकेट करते हैं पेशेंट को कि आपको अगर MS डायग्नोस हुआ है, आपका जो भी बेसलाइन फिटनेस लेवल है उसको आइडेंटिफाई करके एक बताया जाता है कि you are at this level right now. So this disease might cause certain weaknesses, certain instabilities. So it is important that you get your baseline evaluation done. And उस हिसाब से बताया जाता है कि अगर आपको कहीं भी चलने में लड़खड़ाहट हो, you start observing your wobbling gait, you start feeling that the food is not going in your food pipe, when you eat you start coughing, कोई भी symptoms उससे रूबरू करवाया जाता है, so that if you confront any problem आप फटाफट उसको सामने ला सकते हैं, अपने केयर गिवर्स को बता सकते हैं एंड अप्रोप्रिएट थेरेपी आप ले सकते हैं. सो पर्सनली व्हाट आई फील कि जिनको भी MS फर्स्ट टाइम डायग्नोस होता है, देयर आर लॉट्स एंड लॉट्स ऑफ टेस्ट, बट आई फील देर आर 3 ब्रॉड कैटेगरीज. और अगर हम लोग ईजीएस्ट टेस्ट लेके भी चलें, सो दे आर like for physical abilities, timed up and go test, sit to stand test, your manual muscle testing, in fact voluntary control assessment, and 12 item MS walking scale can be used. matlab this is a simplistic I would say a list which we can use to make a baseline evaluation of all our patients. And I feel physical ability is not just the domain that we need to concentrate. In MS we have to take care of their cognitive abilities, and there are huge batteries, बहुत सारे टेस्ट हैं, but most readily and quickly होने वाले हैं आपके Montreal cognitive assessment test, MOCA और mini mental state examination. And for fatigue also we can use modified fatigue impact scale. So what I basically want to emphasize here कि जब भी MS का diagnosis होता है, it becomes imperative कि आप अपने physical therapist को मिलें and आप अपना एक thorough baseline assessment करवा दें. क्यों? क्योंकि वो हमें हेल्प करेगा कि आपका डिजीज कोर्स क्या फॉलो कर रहा है. एंड रिमेंबर, लाइक नॉट ऑल फिंगर्स आर सेम, नॉट symptoms of all the patients are same. हर किसी के symptoms अलग होते हैं, they fall in the same range, that's definite, but उनकी presentation हर एक के pre-existing level के हिसाब से होता है. So एक दूसरे से हमें compare नहीं करना है और हमें रीज़न ज़रूर फाइंड आउट करवाना है कि हमारा बेसलाइन एबिलिटीज़ इस समय क्या चल रही हैं. ठीक है, सो दैट्स समथिंग आई फील इट्स वेरी वेरी इंपॉर्टेंट. ऑलराइट, नाउ ड्यूरिंग द रिमिशन पीरियड, जब रिमिशन स्टेज चल रहा है एंड जब रिलैप्स आता है तब तो फिज़िकल थेरेपिस्ट ज़्यादा कुछ नहीं कर सकते. उसमें यूजली एडमिशन होता है, न्यूरोलॉजिस्ट के अंडर आपको अप्रोप्रिएट ड्रग्स दिए जाते हैं. सो वी मे जस्ट चेक कि आपका फिज़िकल एबिलिटीज़ कैसी हैं उस समय एट द टाइम ऑफ एडमिशन, एंड उसके बाद आपका जैसे ही वो रिलैप्स वाला स्टेज ख़त्म हो जाता है, आपका क्या फिज़िकल स्टेटस है, अगर किसी चीज़ में कोई वीकनेस तो नहीं आई है, डेफिनेटली इट इज़ बेटर टू गेट इट कंपेयर्ड विद योर बेसलाइन इवैल्यूएशन. जैसे फर्स्ट टाइम आपको MS के जब सिम्टम्स आए थे, आपका बेसलाइन चार्ट है, तो डेफिनेटली नेक्स्ट टाइम अगर कोई रिलैप्स आता है जो आपका फिज़िकल स्टेटस है उससे अगर हम कंपेयर करेंगे तो इट इज़ गोइंग give us a very beautiful insight कि what exactly is happening with your body. ओके। एंड जब रिलैप्स हो जाता है तब उसके बाद हमारा फोकस अगेन वही रहता है कि किसी तरह हमारा पेशेंट वापस अपने फिजिकल फंक्शंस पे आ जाए, वो वॉक कर सकें, जो उनके डेली एक्टिविटीज़ हैं वो सब कर सकें. दैट रिमेन्स आर इम्पॉर्टेंट गोल. सो what your physiotherapist does depends on at which particular stage you are. And before, whenever you consult a physical therapist, it's very important that you insist upon getting your thorough examination done, thorough baseline examination done. एंड देन जैसे हमारे एमएस के डिफरेंट फॉर्म्स होते हैं, वैसे ही हमारा जो प्रोग्रेशन लेवल है वो भी डिफरेंट होता जाता है. इन प्रोग्रेसिव एमएस, yes, the person may need more guidance about mobility and stability equipments, how to use them, how to adapt their daily activities so that they save upon their energies and they are able to do their daily course also. एंड देन अगर एम एस एडवांस कर जाता है, वी फील द पेशेंट इज़ नॉट एबल टू गेट ऑफ द बेड और दे आर एबल टू वॉक इंडिपेंडेंटली, देन डेफिनेटली मोबिलिटी एड्स दिए जाते हैं. एंड एक्सरसाइज स्टिल कंटिन्यूज बिकॉज इट्स वेरी इंपॉर्टेंट इवन इफ द पेशेंट आर बेड रिडन. स्ट्रेचिंग टू द बॉडी, रेंज ऑफ मोशन एक्सरसाइजेस, कोर स्ट्रेंथनिंग, जो जो हम लोग बेड पे भी रख के कर सकते हैं, दैट कंटिन्यूज टू हैपन. So in short, physiotherapy is very 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 important right from your diagnosis, and उसी हिसाब से हम आगे proceed करते जाएंगे. Alright, I'm sorry for the background sounds, please. Okay, so if we uh, just a second, I will. Sorry. So now, if we talk about rehabilitation of people with multiple sclerosis, an overview of Cochrane review. Now, this was a very beautiful study published in 2019. They said physiotherapeutic modalities. Modalities means हम किन चीज़ों से इलाज करते हैं, that is exercise या physical activity. It helps to improve the functional outcome. That means the mobility, the muscle strength and the aerobic capacity. Aerobic capacity means your capability to keep performing a task within your limits. ठीक है, ज़्यादा fatigue हुए बिना आप कैसे कैसे different physical activities कर सकते हैं. So basically we help to improve your functional outcome and your quality of life, and thereby reducing the patient reported fatigue. So there is no question that physiotherapy is not effective. Okay, but a comprehensive multidisciplinary rehabilitation approach showed longer term gains in activity and participation. So what is very important is कि आपके जितने भी areas of weakness है, for example balance है, muscle strength है, your coordination issues हैं, swallowing issues हैं, speech issues हैं, there are therapists for each and every branch. So you need to go for a multidisciplinary approach. हर चीज़ का आपको इलाज करवाना है, तभी आपका लॉन्ग टर्म गेन्स हो पाएंगे, वट एवर यू आर एक्सपेक्टिंग आउट. Okay, now this comes the most interesting part. The other day I was just having a word with Rekha ma'am. So we said yes, the real life, online rehabilitation programs have always been very attractive. Probably COVID, thank you to COVID. Well, not many reasons to thank this virus, but yes, thank you to COVID, it pushed us to go beyond our limits and start the rehabilitation program for MS patients also. But let's see somebody who has been guiding us since ages. I don't think Jane Fonda needs any introduction. This beautiful lady is over 80, 84, 85 years old, and she's been guiding us much, much before I was even born, to my mom also, probably. So let's see what she had in store for that generation.
Jane Fonda, actress, author, and award-winning creator of one of the most innovative and inspiring approaches to physical fitness. Her unique exercise methods have grown into a way of life for millions of people around the world. Always on the cutting edge of home video, Jane Fonda's workouts are constantly improving the science of staying fit. For the very best in home fitness, the Jane Fonda Workout Library.
All right, so She is definitely one of my greatest inspiration because I love Pilates and she started doing Pilates way back in 60s. I mean, she just revolutionized this exercise programs. So yes, she was one of the inspiration for these programs. Not directly, but yes, definitely indirectly. So we launched this free online rehabilitation program last year around this time, and in that we had like online classes which I used to upload on my channel, and the frequency of these classes was about 3 classes per week, which went on for 6 weeks. And I had a wonderful batch, and they used to perform those exercises, send me those exercises. We used to correct them, tell them wherever they are not doing it properly, then they used to do it again. Then we used to correct it, then we used to ask them to do it again. This was the sweet side. The bitter side was most of them were really bad in doing their homework, and they had all sorts of excuses for not doing it. And but we pushed them, and I would say my group was so fantastic. It was such a wonderful class कि जो कोई homework नहीं करता था, and if I was away, then वो आपस में ही एक दूसरे को guide करके बोलते थे, come on, you got to do this, you do this, you try this, this is better, okay, I use this shortcut, you use that. So that was my first batch, and I know many of you are here, and yes, I love you all. You guys were just great. You are. So this program, this was absolutely free of cost for 6 weeks, 3 times a week. And what we concentrated here was physical and cognitive rehabilitation. It was not, see, we cannot separate cognition from physical abilities. Why? Because if my patient is not able to think, my patient is not able to understand the exercise, how will I get firing from the brain? The concept is very simple. अगर मैं आपको हाथ भी हिलाने को बोलती हूँ, आई आस्क यू टू मूव योर हैंड, इट इज़ नॉट जस्ट योर मसल पावर. आपके ब्रेन से सिग्नल जनरेट हो रहे हैं, सर्किट्स बन रहे हैं, प्रॉपर सिग्नल जा रहा है जो कि मुझे बता रहा है किस स्पीड से नीचे एंड ऊपर करना है. सो टू गेट दिस एक्शन इन गुड coordinated manner, it is very important that my brain sends the right signal at the right frequency and at the right duration. Same goes for the exercise. Understanding these exercises, making a picture in our mind, activating our brain cells ki yes, I'm going to use these particular parts of the body, and then performing it has more everlasting effect. So when we launched this program, we got around 112 responses, which we scanned, and we found 76 to be eligible people, because this exercise program was for mobile MS patients. So we did their disability rating, and according to that, we selected 76 people, and 65 were to be included in the first batch, which they gave their consent also, and out of which 42 reverted back. So, which was actually quite a good number to start with. So, total 18 therapy sessions we had, and 2 out of which were pre and post assessment sessions. So, this is a small movie of our journey. So, all of you just enjoy this.
Dr. Darshpreet, there is no sound.
Sorry? You
There is
can't.
no sound.
Uh,
Breathe out and try holding it.
oh, let me just check.
Is it there now? Move up, breathe out, hold your abdominals and pelvic floor muscles and come
Now
down.
we are able to hear.
Last, breathe out, hold on to your pelvic floor.
But baby, you keep stealing dances, keep cutting in like you own me, then suddenly throw me away. You say we never had a chance, but you keep throwing me this clay.
बहुत ही बढ़िया। आगे बढ़ने से पहले एक बार हम फिर देख लेते हैं कि हमें इस व्यायाम में अपने सांसों का संतुलन कैसे बनाना है। हम उल्टा लेट गए हैं, सांसें बाहर छोड़ेंगे, साथ ही अपने पैर, छाती और दोनों हाथ ऊपर उठाएंगे। फिर हम रिलैक्स पोजीशन में आएंगे, सांस अंदर। 2 of week 5 is set. Sit comfortably on your ball and slowly move your feet ahead. As you keep moving ahead, pull the ball through your hip till you come at the edge of the ball and your hips are well supported on the ball. Curl back to get the full support in your mid-back and till your scapular region. Now, as you lift up, breathe out. Come up to the level that your elbows touch your thigh region. Breathe out and then go back. Breathe in and then breathe out. The trick in this exercise is to curve your back along the curvature of the ball. Keep doing it for about 10 times. Make sure your shoulder blades are just off the ball. Overwhelming time, this situation for me, because over these weeks we have developed a very strong relationship. Day or night, we have been exchanging videos, we have been correcting each other, we have been encouraging each other to achieve our goal. And I'm so glad that you all have been patiently, slowly, and calmly doing it. But this is not the end. This is just not the end, but it is a beginning to a new life. Yes, this 6 weeks were like an eye-opener for you all, where I wanted you to understand your internal capabilities, your capacities, your willpower, and your mental strength. Yes. You have been underestimating somewhere or the other. Whenever we have interactions with any of the MS patients, most of the time they say, I cannot do that. Ball exercises is something I cannot do that. So now I cannot, I think has been changed to I can. साथ कि आप अब अपने अंदर की इस आग को बिल्कुल भी बुझने नहीं देंगे। अब आपको क्या करना है कि हमने अक्सर 2 दिनों में एक व्यायाम किया था और हर हफ्ते हमने कुल 3 व्यायाम किए थे। अब आगे आपको ये करना है कि एक हफ्ते में हमने जितने भी व्यायाम किए, यानी कि जो 3 व्यायाम करेंगे वो आपको तीनों प्रतिदिन करना है। 3 व्यायाम आप प्रतिदिन 6 हफ्ता सप्ताह में करेंगे। जी हाँ, ये है आपका होमवर्क और यही से आपका एक नया अध्याय शुरू होता है। आप अपने जीवन में किसी भी रुकावट को आगे नहीं आने दें। एमएस को तो बिल्कुल नहीं आगे आने देना, क्योंकि अब आपने सीख लिया है कि आप एमएस को कितनी आसानी से हरा सकते हैं। जरूरत है बस अपने मानसिक मनोबल की और अपने आत्मविश्वास की। कभी भी अपने आप को कमजोर नहीं समझना, क्योंकि जो आपने करके दिखाया है, मेरा विश्वास करिए, आम इंसान से भी अगर मैं बोलूं जिसे एमएस नहीं है, उनके लिए भी ये सब व्यायाम करना बिल्कुल भी आसान नहीं है। पर आपके अंदर जो उत्सुकता थी, जो चाहत थी, वो आपको यहाँ पे लेकर आई है। सो अब आप प्रतिदिन जो जो हमने वीक में किया था, वो तीनों की तीनों एक्सरसाइज एक दिन में करेंगे और सप्ताह पर सप्ताह ऐसे करते जाएंगे। ठीक है? और मैं चाहती हूँ कि आप 3 महीने बाद या 6 महीने बाद मुझे पुनः संपर्क करें और मुझे बताएं कि आप कितने ही बेहतरीन हो चुके हैं, कितनी खूबसूरती से अब आपने चलना शुरू कर दिया है और कितनी बढ़िया तरीके से आपका बैलेंस इंप्रूव हुआ है। ठीक है? सो बस ऐसे ही बढ़ते जाना है, मुड़कर नहीं देखना, और जो कठिनाई आए उस पे हमने विजय प्राप्त करनी है। इसी आशा के साथ, बहुत सारी स्नेह और शुभकामनाओं के साथ आपसे अलविदा लेते हुए आपकी फिजियोथेरेपिस्ट दर्शप्रीत। नमस्कार। our journey.
Swing your arms.
I want to see you all smiling, laughing, dancing. Come on.
Everybody and sing with me. Dance everybody and sing with me. La la la, I'm so happy. Oh so happy.
This is our happy ending. अंदर की बातें किसी को पता नहीं चलेंगी. That's a secret in our group. Okay.
Oh so happy. Sing with me.
All right. So this was our most beautiful journey ever taken. So yeah, it feels just wonderful, just wonderful. I really feel bad to share the real life part now because it was such a happy ending movie that we just saw. But yes, we have to see certain harsh realities because definitely this is going to help us to move further, to devise things further and in much better form. Right.
Yes. I hope my voice is clear. Yeah.
Yes,
Okay.
Darshpreet, we can hear you.
Okay, so going back to that beautiful flow chart, we had 76 people, 65 were included in the first batch, 42 reverted, and 23 non-responders. You knew this story till here, but out of which what happened? Sorry, just 22 continued and 20 left in between. This was a home exercise program which was just 3 days a week, but yet we had almost 50% dropout from this. Now let's see what is exercise adherence among our MS patients. Now this was a recent exercise adherence questionnaire that I sent to most of my patients, and there are very interesting things that have come out of it. So the first question was, what exercise or activities were you asked to do? आपको कौन-कौन से व्यायाम बोले गए थे? And yes, so most of them have responded that इनको individualized exercise program घर पे करने के लिए दिया गया था, right? So yes, this is like hands up for all the physiotherapists out there कि yes, your patients are admitting कि उनको home exercise program दिया गया था. So wonderful job there, physios. Now let's see further. How often were you invited to do these exercises? So most of them agreed that they were asked every day to perform those exercises. I'm just sorry for this technical thing. Okay, so yeah, a good number are saying 4 to 6 days a week, and then even 2 to 3 days a week. So that is overall, that means the majority of patients were asked to perform exercise like for most of the days in a week. Okay. Moving on next. How long were you asked to continue these exercises? आपको कब तक इन व्यायाम को करने के लिए बोला गया था? So that is good. Major portion of them do agree that उनको बोला गया था continuous. You will continue, you will keep doing these exercises. And how often are you doing these exercises? That means how much has this translated? Can you see the facts are speaking for themselves? 75% did agree कि उनको बोला बस अब आपने करते जाना है निरंतर, but उसमें से सिर्फ 43% ही everyday कर रहे हैं, and I can see few not at all also, few 1 day a week also, and yes 2 to 3 days. मतलब अंदर से everybody knows we have to exercise. Okay, all right, let's see further. I exercise less than recommended by my healthcare professional. Okay. Now, this is interesting. पहली बात तो only 75% did agree कि continuous exercise करना है. In that also we had a drop कि 45% were doing every day. And then उस पे भी now we have a good number of people who says जो मेरे therapist बोलते हैं I'm not doing it. Right. So if I see those who strongly, the very good bachas in the class, that makes just 25%. The major portion are my naughty warriors. Despite whatever we say, the majority is by naughty warriors. अब आप मुझे खुद बताइए, if you don't do your homework, how do you expect to pass in your exams? Simple. Right, let's see further. I can't organize myself to do my exercise. Now, this is something really important. जब आप मान लेते हो कि मैं पढ़ाई नहीं कर रहा हूँ अच्छे से, then it is acceptable result नहीं आए. So I'm really happy about even these confused people, 15% of confused people, neither agree nor disagree. It's good that at least major people, most of you do realize कि हम अपनी lifestyle को organize ही नहीं कर पा रहे जिसमें हम exercise को बीच में डालें. Right? For you as a patient, this is very good कि आप खुद देख रहे हो आपके साथ. Oh, sorry. I'm so sorry. ओके, अब आप खुद देख रहे हो कि आपके साथ और कितने फेल होने वाले बच्चे हैं. सो दैट इज गुड. द मेजोरिटी इज लाइक कि हमसे नहीं हो पा रहा है. सी, माई कॉन्सेंट्रेशन इज नॉट ऑन दीज पीपल. दीज आर एनीवेज वेरी गुड स्टूडेंट्स. दे आर गोइंग टू टॉप द क्लास. बट वॉट आई वॉन्ट इज टू लिफ्ट रेस्ट ऑफ यू to compete with them. As simple as that. Okay, now if you realize that you are not able to organize, we are all there. The entire MS society is there to help you organize your things, to let you know when to get your when is the best time to do your exercise based on your daily activities, right? So आपने ये बताया, it's fantastic, but now you should be ready to take chance and change this particular numbers. Okay. Next, other commitments prevent me from doing my exercise. So now, idhar I see a major chunk who are not able to do it, and then other commitments prevent me, only 9% here. That means बच्चों ने बहुत झूठ बोला है. आप लोग पकड़े गए हो. You can't organize yourself to do exercise and then you say other commitments prevent me. Strongly disagree. Okay, अगर other commitments नहीं है तो ये सब क्या है? इतना poor response क्या है? What is it that you are not able to do exercises? You are saying, okay, I totally disagree, not other commitments. Here you are saying you are not able to organize your life. So that means English और maths teacher इकट्ठे बैठे हैं और आप लोग पकड़े गए हो, आप कुछ तो गड़बड़ कर रहे हो. Right? Okay, moving on next. I do my exercise because I like them. Okay, 53% people say I like my exercise, but again this number is not something we can agree because आप में से 75% कह रहे हैं मैं continuous, उसमें से 43% आ गए हैं, उसमें से 53% कैसे कह जाएंगे I do my exercise because आप लोग तो कर ही नहीं रहे हो. Major chunk of you are there जो अपनी lifestyle ही नहीं कर पा रहे हैं. I hope most of you are understanding that you've been caught cheating. Answers copy हुए थे. Yes, and now I know my batch 1, most of you are here. I can see your names. Group में cheating हुई है. There's a parallel WhatsApp group, huh? Answers are being circulated there. Huh? Okay. I'm not sure how to do my exercise. Okay, this is also an acceptable fact that most of you do not know how to do your exercise. So if I accept this point that you don't know how to do your exercise, then definitely this actually satisfy the previous questions कि आपको जब पता ही नहीं है तभी आप organize भी नहीं कर पा रहे हो and other commitments भी रास्ते में नहीं आ रही. The major point is you are not sure how to do your exercise, कि हमारे लिए कौन सी exercise अच्छी है, वो कितनी करनी है, कितनी बारी करनी है. So this is really very acceptable thing. Okay, now I guess by now, is physical rehabilitation effective? This question is obsolete. How physical rehabilitation is effective, that we need to understand now. Okay. Now, neuroplasticity and motor rehabilitation in multiple sclerosis. This is really one of the very interesting factors that I want to highlight here. Rehabilitation of motor function. Please understand this word. Motor function is major component of MS management, which is supported by neural plasticity. That is brain's ability to adapt to MS damage and disability. So जो भी rehabilitation, physical rehabilitation program आप करवाते हैं, हम उसमें आपके bodily functions, motor functions के ऊपर ध्यान देते हैं, and हम वो जितना उस पर ध्यान देंगे, न्यूरल प्लास्टिसिटी, ब्रेन्स में पैटर्न्स ऑल्टर्ड हो जाते हैं जो आपको परफॉर्म करने में हेल्प करते हैं. So evidence suggests that plasticity limits the clinical impact of damage by establishing patterns of brain activity different from healthy volunteers and accompanies improvement in motor performance with practice by adaptively reorganize those altered pattern. So अगर हम बात करेंगे आप नॉर्मल इंडिविजुअल से तो डेफिनेटली अलग हो, बट विद प्रैक्टिस आपके जो पैटर्न्स खराब हो चुके हैं जिसके कारण आपकी फिजिकल एबिलिटीज लिमिट हो चुकी हैं, उनको आप करना सीख सकते हो. Okay, studies on spontaneous recovery after MS relapse shows changes in activation pattern occur with the resolution of active inflammation and parallel recovery of motor function. So बहुत important हो जाता है जब भी हम relapse state से बाहर निकलते हैं कि हम जो इन activation patterns में changes ला सकते हैं उसको हम लाने का प्रयास करें. Okay, recovery oriented interventions can also drive these changes further by reorganizing or restoring. Please understand आपके brain में इतनी capability, इतनी capacity है कि वो फिर से it reorganizes and restores जहाँ जहाँ गड़बड़ी हो चुकी है, even at higher levels of disability and damage. So are you understanding? If you are in a progressive MS, if you are bed bound, whatever stage you are in, आपके ब्रेन में कैपेसिटी है, कैपेबिलिटी है कि आप प्रैक्टिस के साथ 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 इन सब चीज़ों को रीऑर्गेनाइज कर सकते हैं. Such intervention may also include clinically meaningful changes in the brain structures, possibly as a result of activity-dependent remyelination. So now we have huge chunk of research which shares that yes, we can have remyelination, we can change the structure, we can adapt, but all it needs is long term practice. Okay, कोई भी overnight चीज़ नहीं होती है. In fact, I would like to share here that through my Dupre fellowship when I went to France in CERM Lab 1049 under Professor Bruno Brochet, so there was a very beautiful project that was going कि abroad में due to advanced COVID अगर लोगों को driving capabilities उनकी कम हो रही हैं, so we had a simulator system. हमारा एक रूम था जिसमें एक proper रेनो का कार लगा हुआ था, which was basically a simulator, and सामने लाइव स्क्रीन चलता था जिसमें पेशेंट्स को सिखाया जाता था हाउ दे कैन ड्राइव, एंड in the screen there was like a person suddenly comes and cross through, an animal crosses by, when you have to apply brakes, when you have to accelerate, ये सारी चीज़ें पेशेंट को रीट्रेन की जाती थी. उसके बाद फंक्शनल एमआरआई से स्टडी किया जाता था कि वट एवर एरियाज ऑफ द ब्रेन दैट दे हैव टारगेटेड उसमें कुछ मीनिंगफुल चेंज आया है कि नहीं, एंड द रिजल्ट्स वर रियली पॉजिटिव. सो दैट्स व्हाट आई एम सेइंग कि yes, we do have limitations in our country, but we do know about, you know, very sophisticated machineries and things like that, but we do not fall short of alternates that we can use to recover the lost functions. Okay, next, emerging evidence-based physical rehabilitation for MS. Now there are three main physiotherapeutic components, models of motor control that are being used. This was a beautiful study by last year during COVID. I had a wonderful time interacting with Professor Fays. He's from Belgium and they are working extensively, like the rehabilitation in MS, RIM Society, he was president of it, and they have worked extensively in inculcating music in rehabilitations and many other physiotherapeutic modalities. So he, along with many colleagues, they came out with what we can do, what all options do we have to get the motor control. First, the physiotherapy we basically focus on these three areas. First is your muscle re-education, second neurotherapeutic facilitation, and third is task oriented approach. And all your physiotherapists in India, trust me, all the physiotherapists in India are equally equipped. They are being taught. This was a part of our curriculum. All of us knows what these therapies are. Just that you have to approach them, you have to tell them ki please, I want all three things to be started for me to perform better. So for muscle re-education, आपके पास biofeedback training है, aerobic training है, and muscle strengthening techniques हैं. न्यूरोथेरेप्यूटिक फैसिलिटेशन, जिसमें हम बहुत ज़्यादा ब्रेन को फैसिलिटेट करते हैं, वी हैव वोइटा, वी हैव ब्रूनस्टॉर्म, रूट्स, बोबाथ एंड पीएनएफ पैटर्न्स. एंड टास्क ओरिएंटेड, वी हैव पेटो, कंस्ट्रेंट इंड्यूस्ड मूवमेंट थेरेपी. दिस इज बीइंग extensively used in stroke rehabilitation, and it has shown promising results in MS also. Motor relearning program, and then we have modified bobath, locomotor training, and dual tasking methods. So this was even dual tasking method we use in our online classes. जब मैंने साथ साथ आपको बोला था we'll start playing brain games, you have to alternate the activities, follow my activities, and along with it we have to perform some physical exercises. So this we have been using, but अब ज़रूरी क्या है कि आप as a patient also you ask for these things to be started for you. That is very important. Next, now this is really very interesting paper that I came across, a new era of multiple sclerosis, lessons from stroke. See, the stroke rehabilitation, I don't know why it's quite surprising to see a lot of physical therapists are more into stroke rehabilitation rather than MS. But when we talk about neuro rehabilitation, MS, also we get to see many MS patients. So I think it's never harmful to take the latest advances of management in other diseases and try it out in other diseases. At the end, it's a brain, right? The affection may be through different methods, but rehabilitation can be tried to get better results. And they have come up with really good findings that in stroke rehabilitation, high degree of repetition, please mark this word, high degree of repetition of task specific skill is important for neuroplasticity and for relearning lost abilities. एंड येस, ये चीज़ हम MS में भी यूज़ कर सकते हैं. जो मैं बार बार बोलती हूँ, वी हैव टू कीप रिपीटिंग टू रीऑर्गेनाइज आवर ब्रेन सर्किट्स. The author calls for improved understanding of the mechanism underlying the beneficial effects of exercise in patients with MS. Well, this is for researchers, not for patients. It is important to determine the mechanistic underpinning of rehabilitation and optimal time window to provide rehabilitation for MS, and will be especially important for patients after relapse. कई बार क्या होता है, काफ़ी टाइम पेशेंट्स कहते हैं I had a relapse and oh sorry, I cannot perform exercise for 1 week, 2 week, 3 weeks, or they decide their own time. Don't do that. जैसे हम लोग स्ट्रोक में कहते हैं 4 months पोस्ट स्ट्रोक इज़ अ काइंड ऑफ अ गोल्डन पीरियड जिसमें मैक्सिमम मोटर रिकवरी होती है. Similarly, we are yet to establish for MS patient, but definitely we can learn from whatever available literature is there in stroke rehabilitation. So researchers of MS have much to gain by following the latest trends in stroke research and many innovative rehabilitation treatments. So why this line I have included for today's talk? I know a lot of MS warriors are here, but what I want to emphasize is कि जब भी आप rehabilitation specialist को consult करते हैं, आप ये मत पूछिए कि आपने कितने MS patients को treat किया है. Please ask them, are you into a neuro rehabilitation or are you into your ऑर्थोपेडिक रिहैबिलिटेशन. अगर वो न्यूरो में ही काफ़ी टाइम से काम करते आ रहे हैं, चाहे वो स्ट्रोक पेशेंट्स देख रहे हैं, डेफिनेटली दे आर गोइंग टू प्रोवाइड यू विद वेरी गुड रिहैबिलिटेशन. Okay, now Mortal and colleagues highlighted trials of multiple sclerosis rehabilitation with at least a 3 months follow-up. Otherwise it would be waste of resources, and this is what even I experienced. हमारा 6-week program बहुत अच्छा था, but उसके बाद the energy levels and because of lack of follow-up from my side, even सब कुछ fizzle out होना शुरू हो गया, जिसका हमने exercise adherence में देखा है. right? The absence of lasting benefits would suggest that patients' newly acquired skills in balance, strength, or walking are not incorporated in everyday life. So that means अगर इतने दिनों बाद आपको लग रहा है कि आपने जो जो इन 6 हफ्तों में सीखा था वो नहीं हो पा रहा है, डेफिनेटली आपने उसको इनकॉर्पोरेट नहीं किया. एंड जो हमारा अभी हमने पीछे फ्लो चार्ट्स, पाई चार्ट्स देखे थे, उसमें हमें साफ पता चल रहा था कि यू बीन आस्क्ड टू परफॉर्म द एक्सरसाइज कंटिन्यूअसली बट मोस्ट ऑफ यू आर नॉट डूइंग इट एवरी डे एंड the result is right in front of you. So this inability to maintain gain is a major issue for therapists and patients. I see a lot of posts in our MS Warrior WhatsApp group and otherwise also a lot of MS patients contact me. They are like कि नहीं हम ये नहीं कर पा रहे, हमारे पैरों में काफ़ी swelling आ रही है, I feel very fatigued, I feel very depressed and all. See, one thing we have to understand here is MS has happened. We've got MS. We are, as the new word, we are COVID positive, COVID negative. Okay, we are MS positive. What next? What next? जब कोविड हुआ था, like I got COVID last year in May, okay, कोविड पॉजिटिव हुए, what next? क्या करें? Okay, lock yourself, get into quarantine, okay, did it. Then after that, start calling everybody in this world. That was the best time. Nobody would disturb you. You don't have to do anything. 14 days of complete rest, take good care of your body, eat well. Everything took a backstage. Similarly, if you are MS positive, 1,000 times I tell my patients, everything can take a backstage but not your health. Because if you're healthy, you are happy. If you're happy, you are healthy. You are healthy, you are happy. And you are happy, you are healthy. These two H will just go together. And इसमें से एक को भी हम लोग, we cannot underestimate it. So what is important is, okay, I'm MS positive. What next? What next? I will work on my body because I have to do my work on my body. There is no option. Rest, everything will wait. My family has to understand. My boss, my colleagues, everybody has to understand. Right? So please उस चीज़ को करिए because if you are not doing things regularly, it's sheer waste of your time and our time. What I see is inability to maintain gains. This is really 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 sad. आप खुद सोचिए, आप अगर बच्चे को आप 2 का टेबल सुनाते हैं, 2 1 2, 2 2 4, 2 3 6, एक हफ्ते बाद वो भूल जाएगा. इज इट एक्सेप्टेबल? गुस्सा आता है ना? मैंने तुम्हें पिछले हफ्ते ही सिखाया था, क्यों भूल गए? ओके, देन आफ्टर अ मंथ बच्चे को याद रहा क्योंकि डांट पड़ी थी, बट आफ्टर अ मंथ दे अगेन फॉरगेट इट. फिर गुस्सा आएगा, तुमने क्यों भूल गया? बिकॉज एवरीथिंग नीड्स रिवीजन. होता क्या है, जब ये हेल्थ इशू आ जाता है, वी गो ऑन अ डिफरेंट टैंजेंट ऑल टुगेदर. सी, everything has psychological impact. This COVID also had a psychological impact. I know MS has a great psychological impact, but just take it कि बस पॉजिटिव हो गया, बात खत्म. आगे का हमने नहीं सोचना है क्योंकि आगे का हमारे हाथ में नहीं है. वॉट इज देयर इन आवर हैंड? To exercise, to be regular with our diet, don't eat junk food, eat the best thing. I guess MS society as a whole is doing amazing job to bring forth you कि आप क्या करें क्या ना करें. इतनी इन्फॉर्मेशन होते हुए भी आप लोग सब टॉपर्स क्यों नहीं होते हैं? आई विश किसी ने 11वीं 12वीं में मुझे इतना गाइड किया होता तो probably I would have been some scientist somewhere, right? But the whole society is with you. We are backing you day in, day out. Then also why this feeling of depression is coming in? We are there for counseling sessions. We are there for everything that you ask for. That too free of cost. Trust me. We are there for you all free of cost. फिर भी why am I not getting sincerity? That is my question here. I don't want to be harsh, I don't want to be rude, but I want to, if I'm standing with you, what is the reason? I know my patients, you are understanding, I'm pointing or out at you. जिन ने गड़बड़ किया था क्लासेस में, मैंने बहुत उनको मोटिवेट किया, बहुत समझाया, you have to do your classes. Because what you lose today, it won't come back. My online classes are available on the YouTube channel, but उसमें वो momentum नहीं है. They are just like a real life कि videos हैं, आप चला लो. But I cannot be now watching your videos, giving you feedback that regularly जो उस बैच में हुआ था. Are you understanding? एक फ्लो के साथ, एक टीम के साथ काम करने का अलग मज़ा होता है. उस टाइम पे जिन लोगों ने टाइम वेस्ट किया, it's not going to come back. Right? So please make sure कि जो हमें available facilities हैं, we are going to make best use of it, right? Because taking a recovery, that means restoration of function instead of a compensation. Adaptation to change activities approach to rehabilitation involves substantial investment of, I would say, time and effort. मैं बार बार ये कहती हूँ, मैं अपने पेशेंट्स जो वॉक कर रहे हैं उनको व्हील चेयर पे नहीं देखना चाहती. If my patients who are walking, maybe wobbly, they are walking, if they go on a wheelchair, that means we have failed to provide you a good tailor-made rehabilitation. You can be as functional as you want. All you need to be quite regular in doing your activities. Now, what are the advantages? Most of them I have already highlighted. So this was a beautiful scale. This has recently come. There's exercise adherence rating scale, because as a physiotherapist, most of us are really tired. क्यों नहीं करते हैं exercise? So this question there is actually an answer कि we can catch hold of our patients then and there. ये देखिए, this is the reason you are not exercising. So this team has done a wonderful job by coming out with this questionnaire. Now, patients who adhere with their prescribed exercise are significantly better achieving their goals and demonstrate greater increase in physical function. Non-adherence to home exercise program has been shown to be as high as 50 to 65% in musculoskeletal conditions, and in back patients 50 to 70%. And for my MS patients, I can also put it about 50 to 70%. Yeah, okay. And non-adherence to home exercise program increases the risk of recurrent injury or flare-up with less positive outcomes, and can result in physiotherapists believing that their current treatment is not effective. Yes, आप घर पे homework ही नहीं कर रहे हो and you contact us back after a couple of days कि see, I was walking previously, now I've suddenly come onto the bed. तो हमें क्या लगेगा कि probably the therapy given by us was not effective. But on the flip side, the thing is, you were not only doing your exercise. So overall, there is a need of good quality evidence to identify potential barriers to patient adherence. Now, these barriers is something that you only can tell us. आप टाइम नहीं निकाल पा रहे हो, आपको एक्सरसाइज टफ लग रही है, या आपको लग रहा है ये एक्सरसाइज आपके लिए सूटेबल ही नहीं है. These things you can only tell us so that we can all work together and come out with something better. Okay, बहुत गुस्सा हो गया. Okay, now let me be a good teacher. I cannot leave you without another MS Day for 2022. Any guesses? Any guesses? It's going to be an exercise program. I cannot live without giving you an exercise, but this time it will focus more on neuroplasticity and motor rehabilitation through tele rehab program. Again, motor? Oh my god, she's going to again make us exercise. This time on what? She'll hang us to the ceiling and say, come on, perform this kind of exercise. What is she trying to do? No, I'm a big fan of Sushmita Sen, but trust me, I'm not going to use her exercise therapy protocol for you people. Jane Fonda was good enough. Braining together. So that is a theme of our next online classes. But before that, you all have to pledge to be more regular, more attentive, more enthusiastic, and more task specific with me. And the best part about braining together is आपको इसमें physical exercise नहीं करना. We will have the entire motor imagery session here. So again, my online classes will commence from 8th March. This time it will be 8-week programs. We will have 2 classes per week. So a few classes will be pre-recorded as we had previously. Few classes will have me zooming online with you people. And the target will be to improve the brain function through motor imagery, because motor imagery is something which is very important, to activate your brain cells to perform particular task. So this time अगर आपके जितने भी बहाने थे कि हम लोग yeah, Dr. Meenakshi, may I ask you to please mute yourself? Yeah, thank you. So इसमें कोई फिजिकल एक्टिविटी नहीं होगी, हम लोग मेंटल प्ले करेंगे एंड वी विल ट्राई कि हम लोग मेंटली इतना स्ट्रॉन्ग करें कि हमारे ब्रेन सेल्स को इतना एक्टिवेट कर दें कि सडनली यू वेक अप नेक्स्ट मॉर्निंग एंड यू स्टार्ट वॉकिंग. Trust me, I'm not talking like a magician, I'm talking science. There's lots of literature that I go through. Yes, I'm copying a lot of stuff from stroke rehabilitation, as I have mentioned कि हमें stroke से बहुत कुछ सीखना है, and it is proving to be very effective in MS, but definitely it will be worth all our time. So, to summarize, we need comprehensive rehabilitation. We need it for a longer duration. It has to be tailor made. And आप किसी भी टेलर के पास जाते हैं to get your dresses stitched, you are the one who tell what I need. Alright, so you have to tell us what you need. Otherwise, we will club you all together and make just one thing available. Rehabilitation programs are very, very, very important, and we need equal support from patients and caregivers. Thank you very much. Yes, Omicron is going away, Delta going a little away, but stay safe and keep wearing your mask. That is very, very important.
Thank you so much, Darshpreet. As usual, you really hit the ball out of the park. And Javed, here we have another hashtag for us. Hashtag braining together. I think yes, I think that'd be wonderful. There are, of course, a few requests in the chat box. One is that could you share the videos with our MSPs? And of course, we need to, I think we need to motivate our patients, our MSPs more, because I read a post in the chat saying that, I have MSP, so I am, not, I can't deal with things. So I think that's where MSSI should come in and do their bit. Dashpreet, you've been talking about telemedicine, you've been talking about teleconsultations, and that also in rehab. So, how difficult is this? Is it difficult?
Yeah, because frankly, I feel this tele rehab word itself has spoiled us a bit. Patients have somewhere understood that, WhatsApp is there, एक वीडियो कॉल करते हैं and हमारी प्रॉब्लम का समाधान मिल जाएगा. What we are forgetting, the medical sciences relies immensely, rather majorly, on physical examination. इवन इफ अगर आप एमआरआई करवाते हैं, सीटी स्कैन कुछ भी करवाते हैं, इवन अ नॉर्मल अल्ट्रासाउंड, उसके नीचे लिखा होता है काइंडली को रिलेट क्लिनिकली. अब ये केसीसी वर्ड को हमने साइड में कर दिया है, सो इट हैज बिकम काइंडली को रिलेट व्हाट्सएपली, which is just not possible. WhatsApp, I cannot touch my patient. What they show is not, it can guide me through, but it is not something which will give me a solution in designing the rehabilitation program. I get many calls, so I request them to send me voice messages ki what the problem is there with you. But then, for example, dysphagia management, if you don't give them an answer, they feel very bad that she's committed to MSSI, but now she's not giving us time. But what they don't understand is कि dysphagia में पहले हमें पूरा palpate करके देखना है. I have to see your hyoid muscles. You cannot show me. You will show me your platysma, but I want to see your hyoid. I want to see the movement of the cord. I want to see your swallowing pattern. How are you taking the things inside? How your tongue is moving? Whether you have full range of, because tongue is also muscle. Tongue is not just a tissue, it's a muscle, proper muscle, and उसकी जो muscles होती हैं वो criss cross लगी होती हैं. So people don't understand that it's not easy to give them advices without seeing a patient. So what I request them कि आपके nearby जो भी physiotherapist हो आप उनको दिखाएं and take a proper prescription from your therapist. That will guide us कि what power you have, what things need to be done. Then probably we can give you more advanced form of rehabilitation. But I'm sure, Rekha ma'am, you must also be confronting this problem, especially, a lot of relatives take it for granted. अरे फोन घुमाओ से पूछते हैं कि कमर में दर्द है कि what is the treatment, but
Yeah.
it's
Yeah,
it's
I'm a
very difficult.
gastroenterologist, and I can't. If somebody says I've got a pain in abdomen, I need to palpate that abdomen. You see, you're right. Are you thinking of having any such program for physiotherapists themselves? I mean, do you think that, is there any advice you will be giving physiotherapists about this entire new method of conveying neuro rehab to patients?
Yes, I think so. Under the aegis of MSSI, we need to make a task force. We need to make a huge group of physiotherapists available in every city, because with the number of graduate physiotherapists that we have in our country, I guess in every city there are more than 3 to 4 thousand physical therapists in major cities. Like Patna is also full of it. But the problem is our MS patients still don't know whom to contact, and most of them are being treated just like another orthopedic patient having a little, or maybe cerebellar kind of patient having a problem with balance and all that. So I think MS Society as a whole has to organize a more interactive program with physiotherapists, and we need to have more physiotherapists applying for Dupre, so that when you go out, I feel when you go to a higher rehabilitation center, more expert rehabilitation center, that opens your brain, which I feel, because when I met Sheila ma'am way back in 2008, I was just mesmerized with her personality, and I was like, she's a wonderful lady to work with. And MS was just what I read in my textbook, nothing much. But she made me involved so much, so much, so much, that it was an urge that I was just married for maybe about an year or so, and I was like, no, I have to go, I have to apply for this. And my husband was like, what? We just got married, right? And I'm doing my MD. And we go, yeah, you're doing your MD, you are self sufficient, then you'll do your DM wherever you get selected. Let me go and just do that. So I feel definitely whenever one gets a chance, we have to encourage a lot of our young physiotherapists who are quite confused at times how to go about, to please apply for Dupre. Even the nominations are on. Please do that. You will understand how sensitive it is to provide rehabilitation in a neurological setup. So, and till then, definitely MS needs to make a comprehensive WhatsApp group, maybe of physical therapists only, where we can easily share, my this patient is having swollen ankles, because in the group people say swollen ankles, so rehabilitation says ankle pump exercises and massage. But what if you have varicose vein? If you have varicose vein, then massage is contraindicated. We have to make our therapist like, it should click, 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 don't do this for that, do this for that. So I feel this is very much required now. It's very
So I
much.
think Darshpreet will probably get back to you to spearhead this movement, because
Yes.
we all need physiotherapists right across our country, in fact. Before I ask others to take, ask you questions, um, you said that during relapse, you all do not recommend any physiotherapy. But where patients are concerned and they're bed bound, we're always worried about DVT and we're worried
Yes.
about bed sores. So, is
Yes.
there any safe exercise that can be done uh, to avoid these complications? Deep vein thrombosis and bed sores.
Yeah, this is a lovely question. What I meant through during that is, like when we were posted in NEMANS, during the relapse stages, we were posted in the ICUs, and we were asked to make patients do whatever best as a therapist we can. So what we realized, we have a passive role. Passive, what I mean is, we need to tell the nursing staff, or if we are the only one taking care of them, ankle pump exercises, and most importantly is bed turning. Like, okay, DVT is taken care by relatives also. Usually you see the relatives are massaging their feet, putting oil, just making it warm somehow, because extremities sometimes tend to feel cold. But what we lack, there are two very, very important things which caregivers always make a mistake. Like in my 20 years of experience, I've seen in stroke also and in other neurological disorder. One is not properly turning your patient, not being careful that the bed sheet is folded under their body and they are lying on that, because the folded bed sheet is also a point that will lead to bed sores. Then not keeping their back dry enough, because everybody doesn't have air conditioners. We can always put a table fan in front of the patient to keep their back dry. Not putting adequate amount of alcohol, rubbing it across their back, or talcum powder. That is one thing which I have seen. The turning doesn't happen, the bed sheets are not fully stretched, and if you feel slightness of redness, never ever say, "Arey thoda sa hai." ये थोड़ा ही बढ़ता चला जाता है एंड आप नहीं पकड़ पाएंगे. आप ग्लव्स ले लीजिए, उसमें पानी भर के नॉट बांध के जो प्रेशर पॉइंट्स है उनमें डाल दीजिए. समटाइम्स पीपल जस्ट फॉरगेट दीज टाइलॉइड एरियाज, ऑक्सीपिटल एरियाज दे फॉरगेट. मतलब सिर में घाव हो रहा है एंड उनको वो सिर्फ बॉडी टर्न करे जा रहे हैं. सो दोज थिंग्स हैव टू बी टेकन केयर. एंड सेकेंडली, लिफ्टिंग योर पेशेंट. लिफ्टिंग योर पेशेंट. एमएस में भी अगर आपका शोल्डर डिसलोकेशन हो रहा है, स्टेप साइन आ रहा है, आप किस तरह अपने पेशेंट को उठा रहे हैं. बाजू पकड़ा एंड उठा के बिठा दिया. सो ड्यूरिंग अ रिलैप्स फिजियोथेरेपिस्ट हैव अ पैसिव रोल, बट उस पैसिव रोल में भी क्या है, इट्स अ रोल एट द एंड, नॉट एक्टिव बट पैसिव. इट्स अ रोल जिसमें आपको पूरा गाइड थ्रू करना है फैमिली को. एंड इवन पेशेंट भी कॉन्शियस होते हैं, दे आर टॉकिंग इनफ, तो उनको भी बताना है कि आप कैसे करें. एंड मोस्ट ऑफ देम प्लीज मेक यूज ऑफ डाइपर्स. इफ यू कैनॉट टेक पेशेंट, बेड पैन ही देने में हमने देखा है कितनी बारी बटक एरियाज को इंजरी हो रहा है पेशेंट्स में. So these little things, please, physiotherapist, it's a passive role, but definitely it's a role that you have to do it. So that is what I meant during the relapse phase.
Sheila, is there anything you would like to say?
Yeah. See, I was not going to say anything.
No,
but
how
anyway,
can we let you go
I
without
really
saying
feel
it?
this, just now what you told about this turning the patients, and I really know that it happens sometimes to me also. That folded bed sheet is really hurting. Nobody knows about that, and the patient who can't say anything, it is really a point to make. I really this part, Darshpreet, I like best because this is first time Rekha had asked this question, very important question. Every one of us need this thing, how to do treat when the bed sores, not to bed sores to happen there at all. It should not start only. So this is very good. And you know, we had already taken, I mean, therapists, we used to take therapist workshops also with you. You had trained them. So when this virtual thing goes away, we can do the same programs again with you and with others also. I mean, that is very necessary. I know that to take them together and to teach them how to treat MS patients. Sometimes it is better to, I mean, to know them. They know orthopedic cases, but they don't know the delicacy of this. I mean, how delicate these patients are. So they need some different kind of care, no, which you had shown earlier. So let us see. Let us hope that this pandemic completely goes away.
Yes.
And I wish that your Patna comes part of our thing, Mumbai chapter now. We really wish that you really have very good unit. Dr. Gunjan is there, your father-in-law is there. So such a big hospital you are treating. You must be having lot of MS cases there, no? How many?
मैम नॉट
Around?
लॉट बट सिग्निफिकेंट पेशेंट्स. बट होता क्या है, पटना में वट एवर केस यू डायग्नोज, सबकी दौड़ दिल्ली तक होती है. सो मैक्सिमम पेशेंट्स हु गेट डायग्नोज्ड इवन हियर, दे रन टू दिल्ली और टू निमांस. एंड वी ऑल्सो प्रेफर रिकमेंडिंग इट टू निमांस बिकॉज वहाँ पे थोड़ा कॉम्प्रिहेंसिवली इट गेट्स बेटर एनालाइज्ड. So there are good number of patients here in Bihar sector also. And even NMO के भी काफ़ी patients है, but yes, now it has been taken as a different identity. पहले तो दोनों को mixed up ही
दोनों
लिया
को
जाता
MS
था.
ही बोलते थे ना, बराबर. पहले तो
हाँ.
NMO were treated as the MS only. We did
Yes.
have so many of them.
Yes.
Shazia, yeah, would you like to say something? Shazia Khan?
Yes, ma'am. I'm so sorry to disturb. I mean to interrupt.
No,
But
it's your platform. Please come.
You have every right to say something.
Actually, ma'am, yeah. Actually, I wanted to speak to her behalf. मैं उसकी भाभी हूँ. Ma'am, मुझे ये जानना है, ma'am. There are certain cases. It happened that they were MS patient. They took all the therapy. They took all the treatment which is required to handle it. But after some time, after some year, it suddenly happened that in MRI their MS is not even diagnosed. Means they are completely free from MS. Okay, it's just a miracle we can say, because as if now there is it's completely कि MS का कोई इलाज ही नहीं है. Only therapy is there and all. तो जिन लोगों के completely MS चला गया है, like after some year or something, okay, so उनका reason क्या है, मीन्स उन्होंने ऐसा क्या खाया, like what happened, whatever they did कि उनका MS ही completely चला गया. So is it possible that it can happen with everyone?
Anything is
So
possible.
all people will be happy.
Rekha ma'am, probably you are the
वो
better one
including
to
है.
answer this.
Yeah, I'm not a neurologist, but Shazia, हमने भी एक दो हमारे मुंबई में भी ऐसे हैं जो डायग्नोस हुए थे on the MRI, and then after that they they were okay, and MRI done after a number of years did not show any lesions. So
Hmm.
see, the brain is a very marvelous organ, and though today everything is now being focused on remyelination and how do we improve remyelination. In fact, Darshpreet just showed us one of the articles where they said that maybe exercise induced remyelination or exercise activated remyelination is a possibility. So yes, it may be it just that nature healed itself, I mean, and these come under the headings of miracles simply because we have no scientific answers for them. But they
Okay,
do happen. It can happen.
okay, it
So
can happen. Wow.
it does happen. It
I
does
hope
happen.
that it should happen with everyone. Okay, thank you,
Oh,
ma'am. Thank you so much.
that's a wonderful prayer, Shazia. I think we should all pray that happens. Okay.
Yeah, ma'am. Yeah. Thank you so much.
Uh, anyone else who wants? Oh yes, Ritesh. Ritesh, could you?
Yes, ma'am.
Yeah. Yeah.
So, ma'am, actually, my question to Darshpreet, ma'am. So, ma'am, मुझे अभी थोड़ा सा ना, मुझे 2-3 महीने से ये imbalance का problem है ही है. I'm recently diagnosed with MS. I mean, 21 October, the first time I diagnosed with MS. So, मुझे imbalance का problem. I mean, I have been treated with DMTs. I think December mid, and still I'm feeling this imbalance based on the situation. If things are not going according to how I wish it to be, so उस टाइम मुझे थोड़ा सा इम्बैलेंस लगने लगता है. बट अगर मैं बैठा हुआ हूँ या मैं अपने हिसाब से कुछ कर रहा हूँ तो मुझे नॉर्मल लगता है, सब चीज नॉर्मल है. सो मैम मैं ये जो एक्सरसाइज एंड ऑल वो मैं कर सकता हूँ अभी, राइट? एंड द सेकेंड क्वेश्चन आई वांटेड टू आस्क यू, आपका जो मैं सेशन लेट ज्वाइन किया था, तो उसमें पहले के जो कोर्सेज थे वो सारी यूट्यूब वीडियो से फॉलो करके मुझे प्रैक्टिस करना है. एंड द सेकेंड जो 8th of March से चालू होना है, उसके लिए सब्सक्राइब कहाँ से करना है?
ओके रितेश, सो आई टेक योर
Yes.
3 क्वेश्चंस.
Thank you,
पहला
ma'am.
ये है कि आपका अक्टूबर में डायग्नोस हुआ था, तो इसके लिए आपको बैलेंस इश्यूज जो आप बोल रहे हैं उसमें आपने एक कंपोनेंट बोला है कि जब चीज़ें मेरे हिसाब से चलती हैं तब ठीक है, जब नहीं होता है तो थोड़ा बैलेंस में प्रॉब्लम है. सो
Exactly, ma'am.
दैट गिव्स अ लिटिल आइडिया कि मे बी एंग्जाइटी इंड्यूस्ड भी ये है. बट बिफोर लेबलिंग इट एनीथिंग, व्हाट आई वांट है कि आप जिस भी सिटी में रहते हैं आप अपने एक फिजिकल थेरेपिस्ट से मिलिए एंड प्लीज़ रिक्वेस्ट देम कि आपकी फिजिकल एबिलिटीज़, आपकी कॉग्निटिव एबिलिटीज़ एंड आपकी जनरल फटीग लेवल्स, इन तीनों को एक बेसलाइन तरीके से इवैल्यूएट करें, राइट? एंड उसका जब इवैल्यूएशन एक आएगा, यू कैन सेंड मी द रिपोर्ट्स थ्रू माय व्हाट्सएप नंबर. उसको मैं कंपेयर करना चाहूँगी आपकी एमआरआई फाइंडिंग से कि आपके अगर कोई लीजन निकला है, एमआरआई डायग्नोस हुआ है, तो वो ब्रेन के किस रीजन में है, राइट? बिकॉज बैलेंस इशू न्यूली डायग्नोस केसेस में अगर आ रहे हैं तो हमें ज़रूर देखना पड़ेगा कि सेरिबेलम रीजन में कोई अफेक्शन तो नहीं है. जो भी है
Okay.
उनको कंपेयर किया जाएगा. फिर उसके हिसाब से आपको बैलेंस स्पेसिफिक एक्सरसाइज, बिकॉज बैलेंस के भी बहुत कंपोनेंट होते हैं. आपका डायनेमिक बैलेंस होता है, स्टैटिक बैलेंस होता है. किस बैलेंस में आपको प्रॉब्लम आ रही है? सीधे खड़े होके आगे पैर रखने में, जिसे हम स्टेप इनिशिएशन कहते हैं, उसमें इशू आ रहा है, या चलते चलते आप वॉबल करते हैं, या चलते चलते आप एक ही साइड ले लेते हैं. तो इसके लिए आपका प्रॉपर बैलेंस एनालिसिस होना विद गेट एनालिसिस बहुत ज़रूरी है. और ये मैंने जितनी भी बातें बोली हैं ये कोई बहुत सोफिस्टिकेटेड चीज़ें नहीं है, ये हमारे नॉर्मल कोर्स ऑफ फिजियोथेरेपी में होती हैं. तो जो भी अच्छा सेंटर होगा वो आपको बहुत आसानी से ये सब करके दे सकते हैं. ओके, दैट्स द आंसर टू योर नंबर 1. नंबर 2, मेरे जितने भी वीडियोस हैं जो लास्ट ईयर हमारा कोर्स हुआ था मेरे यूट्यूब चैनल में, फेज़ 1 ऑनलाइन एमएस प्रोग्राम के नाम से हैं, उसको आपको जब भी फॉलो करना है पूरी शिद्दत से कीजिएगा और उसी फ्रीक्वेंसी में कि हफ्ते में आपने सिर्फ 3 वीडियोस देखने हैं और उनको प्रैक्टिस करना है. उसके बाद आप नेक्स्ट कर सकते हैं, और अगर आप चाहें तो वीक बाय वीक आप अपनी एक्सरसाइज की वीडियो, शॉर्ट वीडियो मे बी 5 to 10 सेकेंड्स की बना के मुझे भेज सकते हैं, उसको भी मैं करेक्ट करके आपको भेज दूंगी. बट आपको खुद से इसमें एक अपनी रेगुलरिटी लानी होगी, ठीक है. एंड उसके बाद ये जो नया कोर्स हमारा शुरू हो रहा है इस साल 2022 का, तो एमएस सोसाइटी को मैं एक पहले जैसे हमने प्री असेसमेंट फॉर्म होता है, बिकॉज मेंटल इमेजरी क्लासेस करवाने के लिए हम लोग इसको ग्रुप में अगर लेंगे, बहुत ज़रूरी है कि मुझे आपका बेस लाइन इवेल्युएशन पेशेंट्स का पता हो. तो जैसे एक्सरसाइज का गूगल फॉर्म आया था, ऐसे ही मेंटल इमेजरी कैपेसिटी का एक गूगल फॉर्म आपके पास आएगा. जिन जो जो इंटरेस्टेड होंगे वो उसको भर देंगे. उसके बाद अगेन हम उन फॉर्म्स को स्क्रीन करेंगे कि किन किन पेशेंट्स को हम इन ऑनलाइन चैप्टर में ले सकते हैं. उस हिसाब से आपको बताया जाएगा. फिर एक व्हाट्सएप ग्रुप बनेगा, उसमें हमारी जो भी लाइव जूम मीटिंग होंगी उनकी टाइमिंग्स ऑलरेडी इन्फॉर्म कर दी जाएंगी और क्लासेस हमारी प्रोसीड करेंगी. ओके,
Yeah, thanks a lot, ma'am, for
Most
all the
welcome.
answers.
मोस्ट वेलकम.
मैम बस एक फीडबैक, आई डोंट नो टू मैं किसको बोल रहा हूँ, बट एक फीडबैक, लास्ट टाइम व्हाट हैपेंड, देयर वाज वन सेशन फॉर अ डाइट प्लान. सो उस टाइम पे भी ऐसा बोला गया था कि डॉक्टर का नंबर शेयर किया जाएगा, बट मैं मेल में फॉलो अप करते जा रहा हूँ, बट मुझे कोई नंबर या कुछ शेयर ही नहीं कर रहा है. So, ma'am, I just wanted to ask, Darshpreet, ma'am, I just wanted to ask you, I mean, if you can just send your number so that I can save it
My
immediately
number,
instead of.
all the information is everything on Google. ओके, सो अगर आप मेरा बिहार न्यूरो सेंटर पटना भी डालेंगे, मेरा जो नेम बोर्ड है और मेरे जो फ़ोन नंबर है सब उसमें आ जाएंगे. यू वोंट हैव अ प्रॉब्लम, एंड स्टिल आई एम सेंडिंग यू अ पर्सनल मैसेज विद माय नंबर. ओके,
Okay. Thank you, Darshpreet.
Yeah.
Is there anyone else who would like to ask a question? Otherwise, I will ask Sundari from our the Honorary Secretary of the Mumbai chapter to give her, thank you address.
Good evening, everyone. At the outset, I take this opportunity to thank each and everyone for joining the webinar and making our program a grand success. Dr. Darshpreet, with your enlightening presentation, I am sure that all our MSPs got successfully benefited. And our MSPs always like your sessions as your guiding skills and advanced rehabilitation techniques, helping them to lead a productive life. My special thanks to Dr. Darshpreet for the wonderful educational seminar and also supporting our cause all the time. As you have shown one slide, happy dancing. We are all very happy with your session and dancing today. Thank you very much, Dr. Darshpreet. And thank you, Dr. Rekha, for hosting today's webinar. Lastly, but not the least, I would like to thank Mr. Javed for all the technical support from the bank end. Thank you all. Okay.
Thank you, Sundari.
Thank you, Sundari ma'am.
Yeah. Thank you, Darshpreet. It was really wonderful having you with us. We are
Thank you,
definitely
ma'am.
going to pick your brains and get you to start the hashtag braining together.
Together.
Yeah. Okay.
Yes, ma'am.
Right.
Thank you,
Kavit,
thank you,
could you,
everyone.
Thank you,
Kavit, could you end the session, please?
I want to see the beautiful lady, white-haired, beautiful lady from
No,
Mumbai,
yeah,
Sayan. Where is
I
she?
can't show you. I can't show you myself today. Maybe after some time. Maybe next talk only.
Okay.
I'm hiding now.
Okay.
No, but this is such an encouraging. I never thought that immediately you are going to start another one. And this is braining is really something very different and very necessary. Thank you so much.
Thank you, thank you,
all the
ma'am. Thank you.
Thank you. Really, you have done excellent seminar today.
Thank you, ma'am.
Thank you. Thank you.
Thank you,
Yeah,
everyone.
Bye bye.
Yeah.
Bye.
Javed, thank you very much. Always supporting.
Thank you,
Thank you.
Meera ma'am. Thank you, Dr. Rekha. Thank you, Dr.
Yeah,
Darshpreet.
thank you,
Thank you,
Javed.
Mr.
It was
Javed.
great of you
Thank you.
coming and
रेखा
helping
तो
us
मेरी
out.
है, रेखा ही तो मेरी है, तो मुझे थैंक देना जरूरी नहीं ना रेखा
नहीं
को।
नहीं 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 बाबा, ऐसे हम एक मिकी को थैंक्स देने लगेंगे तो कैसे चलेगा?
इसीलिए रेखा तो मेरी है,
ओके
उसका थैंक
ओके, चलो,
बाय।
थैंक